to make an adequate response to natural infection. So we know that measles is a serious disease, but the body clears measles in the overwhelming majority of individuals and leaves those people with an immune response that protects them against reinfection. So measles has already proved the concept that the body can make a good response. That's not the case with HIV for reasons that are very perplexing. The body does not make a very good response against HIV that can protect them, which is the reason why of all the millions and millions of cases of HIV, there have been really no instances of spontaneous removal of the virus from the body purely on the basis of your natural immune response. However, with other viruses, including respiratory viruses, we know the body does make a good immune response. So many, many, many people recover from coronavirus infection, this novel coronavirus, which is giving us so much trouble. So the very fact that people can mount a natural immune response that gets rid of the virus in them makes me cautiously optimistic that we can develop a vaccine that can mimic natural infection enough to induce that same sort of response that would ultimately protect people. So there's no guarantee, David, there's never a guarantee of success, but the fact that the body can do it gives me cautious optimism.
But could COVID-19 mutate into a COVID-20 such that the vaccine wouldn't be adequate for a mutation of the existing virus?
That is always possible, David. It likely would mutate less to make it evasive of the vaccine than it might to make it a little more or less virulent or a little bit more or less resistant to a drug. For it to mutate so that the vaccine doesn't work is possible and could occur. And that's the reason why you need to do carefully designed and well-controlled studies to look at the efficacy and match it against the immune response to the particular virus that happens to be currently circulating.
And why do you think this virus has been so damaging to people who are elderly, people over, let's say, 60 or 65 or something like that, or people who are African-American or other people of color? Why do you think that's the case?
Well, one of the issues that's very clear is that even if you look at influenza, which we have a lot of experience, influenza and other types of viruses always hurt the elderly and people with underlying conditions more than healthy young people. The interesting thing about this infection is that, for the most part, with some exceptions, it is very heavily concentrated towards people who get into trouble are those who have the underlying conditions. That is mostly hypertension, diabetes, obesity, some chronic lung disease. We don't fully appreciate and understand what I call the pathogenic mechanisms of this virus. But as we learn more about it, we see that it has a complicated way of hurting the body. But if you have an underlying condition, as with many viruses, it makes you much higher at risk, not of getting infected, but of actually getting a deleterious consequence. With regard to African Americans, unfortunately, the disparity in health that has nothing to do with coronavirus that we've known forever is that the African American community suffers disproportionately with those diseases like hypertension, like diabetes, that actually give you a greater possibility of having a poor adverse outcome. So it's a double whammy. They disproportionately have these diseases that are bad enough to begin with, and that puts them at additional risk of getting a very poor outcome when they do get infected.
Well, there are 330 million people in the United States who are worried about your health every day. So how are you staying healthy and how are you avoiding this virus? Because nobody wants you to be incapacitated. What are you doing to stay healthy?
Well, I'm not doing things that I would recommend to others because my day is just, ridiculous. In the beginning, I was foolish because we had so many things to do that I was getting 3 hours of sleep a night, and that doesn't work very well for more than a few days in a row. So listening to the advice of my very clinically skilled wife, who was formerly a practicing nurse, the thing that I do now that I didn't do before is get at least 5 or 6 hours sleep, which I didn't before. So I think that, and staying away from people to the extent that I can, doing everything virtual the way we're doing now is I think keeping me okay. I'm running a little bit on fumes, but they're pretty good fumes.
What about your voice? People keep commenting on it's a little raspy. What are you doing? You talking too much or what?
Yeah, it's exactly that, David. When in December, unfortunately for me, I got influenza A, H1N1. I developed a tracheitis that gradually was getting better. And then came coronavirus, which had me briefing, at least in my mind, almost every congressman, every senator, every governor, and doing 5, 6, 7 interviews a day. That when you get your voice damaged a little, your trachea, I probably have a polyp there, that the only way you're going to make it get better is to keep your mouth shut.
Well,
but that's not in the cards right now.
So tell us what the coronavirus task force is like. Everybody sits around and saying how everything is great and people argue with each other. What are those meetings like?
No, it's a good meeting. We have a good bunch of colleagues in it. It's led by Vice President Pence. We have various cabinet members are there, predominantly Alex Azar. We have Ben Carson. We have Chad Wolf and others who are actually active members. We have medical people, myself, Bob Redfield, Debbie Burks, Steve Hahn. So we have a good group of individuals that actually go over the data from the night before, what the pattern and the dynamics of the outbreak are, and we address the different issues, some of which you've already mentioned, things like testing, things like the ability to have enough ventilators, PPE, plans for the states, interacting with them. And then we do that for about an hour and a half or more. And then we gather and decide we don't decide, the vice president and his staff decide what the topic for the press briefing is going to be. And then we brief a little summary after we brief the president, and then we go out and do the press conference.
People get nervous when you don't show up at those press conferences. When you don't show up, is that because you're doing something else that's more important, or does people get nervous when you're not there?
Well, David, the press conferences are often topic related. And when there is a topic that's more appropriate for someone else to be the backup, they do that. For example, yesterday it was testing. So the person that was predominant there were the people who were involved in testing. I'm a health physician, scientist, public health person. So when the discussion, which most of the time it is, I've been involved in most of, but not all of them. It isn't, a lot of times when people don't see me, they think that there's some problem between the president and I, and that's really not the case at all.
So you're 79 years old, but in great shape. You power walk 3 miles a day. Power walking means you're walking fast, right?
Power walk means I'm trying to catch up with my wife, who's walking faster than I am.
But your goal is to do this for another 10 years or so. How much longer would you like to do this job?
David, that's a good question. You've been asking me that for decades. I'm going to do it until I feel that I'm not doing it as effectively as I can. And right now, I think I'm as good as I've ever been because not only do I still have the energy I had, but I have a lot more experience.
So do you think in hindsight, had you been a couple inches taller, you could have been a one and done college basketball player because you were a high school basketball star? Why did you aspire to go to the NBA or not?
Well, the answer is every young kid in New York City who plays, in the schoolyards and gets good at it and does well in high school always has aspirations. And often the aspirations are not connected to the reality. So I inherited a couple of things from my father. My father, interestingly, when he was in high school, was the New York City champion of the 220 and the 440-yard dash. He was very fast. So on a basketball court, you couldn't catch me on a fast break. However, I also inherited his height. And I found out something that's the rule in basketball, that a very fast 5'7" point guard who's a good shooter will always get crushed by a very fast 6'3" point guard who's a good shooter.
Well, I had the problem. I wasn't a good shooter either. I wasn't anything, so I didn't get very far either. Tony, thank you very much for this. Thank you for what you're doing for the country. Stay well, get some tea and honey, keep your voice in shape, and keep working as hard as you can. Thank you.
Thank you very much, David. It's always a pleasure. Thank you for having me.
Okay, thank you.
Take care.
So now we're going to go to Arnie Sorensen. Arnie is in his home in Maryland. Arnie is the CEO of Marriott. He's been in that position for the last 8 years. And Arnie, can you see me now?
I think I can, David.
Okay.
Can you see me?
Okay. Now, Arnie, let me ask at the beginning about your own health. It's been